Hi, my name is Dr. Robert Wright Jr. of StressFreeNow.info. Today, I'm here in West Palm Beach with Dr. Les Femi and his lovely wife, Susan Shore Femi, and we are going to tell you about Open Focus. Les and Susan are from the Princeton Biofeedback Center, and I'm going to let them tell their story. So we'll start with you, Dr. Femi, to talk a little bit about introducing yourself and about Open Focus.
Well, my name is Les Femi, and I've been working on a project I call Open Focus for many years. There are a number of stories that feed into this discovery, and too many and perhaps too difficult to relate to how Open Focus came into being. But in any case, I'm interested in space. I'm interested in the way we appreciate space, the way we feel about space, and the fact that it's always there and always around and through you is a unique property of our universe. Space is more important in our perception of the world than we realize. In fact, just by adjusting our attention to space, we can dissolve pain, for example. Everyone's interested in dissolving pain, and it's amazing how effective it is just by bringing space into the picture. Tensions diffuse, the brain adjusts itself such that pain dissolves. Is that enough?
That sounds great. Susan?
Yeah, we, in the Princeton Biofeedback Center, we do a combination of something called neurofeedback and open focus training. Neurofeedback is a method that allows us to train our brainwave activity so we can learn to produce brainwaves associated with normalized, relaxed, but alert attention. Open focus training is an attention training behavior that you can learn that teaches you how to attend in ways to bring about these brainwaves. So you have two things coming together. You have the neurofeedback, where you're training the brainwaves, and the open focus attention, which is teaching you the behavior that comes with these kind of brainwaves. And so neurofeedback and open focus come together. Les discovered it over many years. He was a senior research fellow at the Brain Research Institute at UCLA 40 years ago, and discovered things about the nervous system, that things work better in the nervous system when there's a synchrony. He then took that understanding and explored what other things exist in the nervous system that have synchrony, and discovered the brain waves. They are alpha brainwaves, which can be taught to be produced in abundant synchrony. So that when you are producing whole brain synchronous activity in the alpha range, and when you're attending in open focus attention, your central nervous system becomes balanced, and you are no longer in that over arousal, but you have access to relaxation and arousal as needed. And that's the work that we do.
Wonderful, Susan. I want to thank you, because what you have described is essentially achieving an elevated relaxation response, which goes to contribute towards allostasis and then leading to homeostasis. And so, although we don't normally talk about that, that's actually what is happening.
And we say relaxation is a side effect. Normalization is what we're aiming at, and relaxation is a side effect.
Okay, so excellent. So, Susan, you have, I think our guests could really benefit from hearing a little bit of your personal story about anxiety and how you've dealt with it. And then also, could you elaborate on how you work with helping clients that have anxiety? You know, to me, anxiety is a much larger issue in our society today than people generally acknowledge. People talk about stress, people talk about grief, people talk about pain, but panic attacks and a general sense of anxiety. And I like, if you could, to talk about a little bit about what anxiety is in terms of the when a person starts to catastrophize, and so they are typically either projecting into the future about some event that may happen, or they're ruminating about some event in the past. And what I've found with clients is that when I ask them, can you feel anxious if you're fully present in the present moment? And they generally say no. So I think our audience could benefit from that.
Well, as you were saying before, that when you start attending to space, when you bring space into your total awareness, this sympathetic autonomic nervous system, which creates over-arousal and what we call fight or flight response, anxiety, adrenaline, cortisol, muscle tension tightening, blood flow distortions, all remit when you open up to space. So what Les has taught us is that if you begin to open up to space and immerse yourself in space, that's a kind of being in the present moment, and in that expanded space, feel into the body experience of anxiety, the anxiety disappears because the over-arousal that caused the anxiety in the first place goes away. We don't do cognitive work, cognitive behavioral work. We don't even need to know why you're feeling anxious. This is such a simple and non-verbal technique of opening up to space and immersing yourself into feeling, and the feelings go away, the feelings of anxiety. Opposite to what we're taught in this culture, to avoid something. Oh, you're feeling anxious, go think about something else.
Right.
Les has discovered and taught that the opening and entering into, what if I left out?
Everything.
Everything.
Well, I just had a brilliant idea.
We'd like to leave out everything.
The brilliant idea is that, Les, could you lead us on a short, a 3 or 4 minute open focus so the audience could get a sense?
I never thought you'd ask.
Okay, thank you. It just occurred to me when light bulb came on.
Well, our goal is to accept a direct experience of space, and it's all around us. All you need to do is attend to it, and you realize it's everywhere, and it goes through everything, and that's the background. Now, that was a part of the exercise right there in a conversational mode. And now, can you imagine feeling around your body for some feeling, some emotion, some pain, something you don't even have a name for, that stands out from the rest of the presence of your body and space. And using that as the pain, begin to merge with that feeling while you continue to manifest a wide open awareness of space. And imagine bathing in the pain, loving your way right into the heart of the pain and letting it spread. And a number of repetitions of this, maybe 2, maybe 3, and the pain is diffused and dissolved. It may come back because we have certain habits that cultivate the return of pain. However, all you need to do is go back to open space and merging with the pain, and we're back to zero again. Eventually we learn not to adopt the habits that produce the anxiety or whatever it is that we're wanting to dissolve. I know you asked for anxiety, and it is one of the main problems of civilized men. They're so used to narrow focusing and gripping with their minds. They have headaches and frontal lobes and parietal lobes and neck aches, etc. Because we're holding those body parts in a grip. And what we want to do is melt into that grip, that tension, that feeling of holding, and emerge. And merge with space and feeling.
specifics, but if you're anxious, there's a way to find anxiety as a sensation in the body. I always get it right in here or in here, to just open up and feel into what we call pain, but is the location of the anxiety.
That, okay?
Yeah, and audience, in case you're wondering what Dr. Femi was referring to, he has a couple books out with Jim Robbins. One book is The Open Focus Brain, with Jim Robbins as a co-author, and the other book is Dissolving Pain. They're both bestsellers on Amazon. Here's a question for you. I've asked you this question before. Normally, you and Susan talk about stress, anxiety, and chronic pain. However, in your Dissolving Pain book, you have a story about, and I can't remember if I get it right, it's either you went to the eye doctor or you went to the dentist, and the gentleman was crying. He said his mother had passed away.
Yeah, optometrist,
And
yeah.
it's the eye doctor, okay? And you were explaining to him how to dissolve grief. And, you know, grief is, on one level, a taboo subject, still taboo. You know, people don't really talk about death and dying, and when they do, they tend to be a little bit uncomfortable. It's not something you grow up talking about. So can you briefly tell that story, how you showed this eye doctor how to dissolve his grief, and how it was just a simple exercise, but it was through the increase in awareness. And I know for me that when you have said to me, you know, well, Bob, continue to fully immerse yourself into the whatever experience that you're having, that I continue to be amazed at how that evolves and devolves and just spreads out.
Yes. Yes. Well, the story has been told. I came to the eye doctor for my own purposes, and I found the optician tearful, and I asked what the problem was, and he said that his father just died, and he had a very strong emotional reaction to that, and he couldn't stop crying, and this was many weeks after the father had died, so it was really taking him over. And I just asked him to include an awareness of space around the feeling of grief, or whatever the feeling he was, sadness, whatever the feeling he was feeling, and to immerse himself in the feeling of grief and in the experience of space, until by the time I left, he had stopped crying, and he was not able to stop crying before that time. So it's a one-shot training session, basically, and it worked remarkably well in this case.
But I just, what occurred to me with this story, and why I keep bringing it up almost every time I see you, is that, can you explain to our audience, what is it about holding on tight or resisting? Yesterday in the training that you were doing, both you and Susan did exercises about what does this resistance refer to, or I forget the exact phrase that you used, but the point is that holding on to the resistance, rather than you say go into it and merge into it, and that dissolves it. Can you explain why that happens? What is it about the nervous system? And I imagine, you know, that it has to do with attention. So in your experience, in your clinical experience, why is that the case, that doing the opposite of the clenching, narrow focus, gripping, to use your words, why does doing the opposite dissipate and dissolve the pain, stress, or grief?
What created it in the first place was the holding. Otherwise, it would have been just a passing feeling or emotion that we all have. And we let go most of them. You know, go through, sometimes it takes longer than others, but we generally let most of them go through. But at some point we meet a feeling or an experience that we just can't control, we can't escape. And what we do is resist it, physically resist it. It's actually just as simple as that. Usually muscular tension is associated with it. And you hold on to the experience by gripping it, holding it, resisting the feeling of it. And all one needs to do is reverse this, is to open their focus and then open the focus that is related to the feeling under treatment and melt into that feeling and end up with a sense of well-being as opposed to painful legacy.
I just want to say what I think is so wonderful about the work that you've done, and it took 40 years to fully develop it, and it's all in the open focus brain. But the fact is that when we open up to space, brain waves slow down and become more rhythmic. More rhythmic, slow wave activity in the brain is a reflection of a nervous system that is in balance. If it's not in balance and you're in fight or flight, you have sympathetic over-arousal, which has all the experiences of pain and anxiety. As soon as you open up to space and brain waves slow down and get more rhythmic, and the nervous system now is producing relaxation when necessary and activation when necessary, all by opening up to space. And your work, which is so wonderful, it's not a belief system, it's not an idea. He was able to see on neurofeedback equipment, on brainwave equipment, that when you open up to space, these brain waves actually change. And these changed brain waves reflect a whole nervous system that's in balance. And the nervous system controls all the peripheral systems, the vascular system, which makes us cold and withdraws blood from the skin, the muscular system, which tenses up our muscles, and the endocrine system, which creates adrenaline and cortisol. So you have a simple effect: space, slower, more rhythmic brain waves, a balanced nervous system, and all the peripheral systems come online. It is that simple. And what Les has developed is this simple way to get there is space. You don't have to think about it. You don't have to worry about the content of your thoughts. You don't have to look at what happened when you were 5 years old. How simple.
Wonderful, that's great. Thank you, Susan. What I'm thinking is to explain to our audience why we are here. I just want to mention we are in West Palm Beach, Florida, not in your office in Princeton,
Yes.
New Jersey, where it's a slightly chillier. So as we begin to wrap up, I want either or both of you to just talk about the workshop that you just did here, and then describe the services that you offer at the Princeton Biofeedback Center, and how people can contact you if they want to work with you or learn more.
We present 3-day workshops that 2 of the 3 days involve working on the biofeedback equipment, the neurofeedback equipment, so people learn how to open their focus and produce these slow rhythmic brainwaves. So the first 2 days are on the equipment. The 3rd day is the open focus practice itself. So people come away knowing how to change their brainwaves by attending an open focus, and have a chance to be on the equipment or even purchase it if they want to. At our clinic, we have a full service clinic. We provide neurofeedback and open focus training, and we treat every stress-related disorder, from anxiety and depression to physical pains of various kinds, attention deficit disorders. We do a lot of peak performance training, athletes and artists, performing artists, the whole gamut of a full-service clinic. And we can be reached through our website, openfocus.com, which has our phone number and our email addresses. And insurance often covers treatment. We do Skype sessions, and we do mini intensives where somebody can come for a period of time and get an intense training, or weekly sessions as any.
Audience, the Princeton Biofeedback Center is located in Princeton, New Jersey, and their website is openfocus.com. And Lester, Susan, can you give audience your telephone number?
Sure. 609-924-0782.
Well, I want to thank both of you for agreeing to do this interview with us today.
Thank
And-
you, Bob.
And you are an Open Focus trainer, so you teach Open Focus too.
And it's almost a 10-year anniversary
Is it
that I
really?
realized that I became certified in 2005. And so this has been an ongoing, evolving experience. And I have to tell you, the training that you just completed, well, I actually said that Susan, you were masterful and you're the master.
Hey, what is
No, you're the master, and I'm
Okay.
master.
I said you were the
That's
master.
it.
Okay,
She's
all right.
Said by a
masterful.
true diplomat.
Okay. So wrapping up, what final thought or key idea would you like our audience to take away from today's broadcast?
Space is your friend. And learning how to pay attention in the 4 basic ways is incalculable in value in order to manage your life. You need narrow focus, you need objective focus, you need diffuse awareness, and you need immersed awareness. All 3 in space. All 4 in space.
Susan?
Same thing, that it's so simple. Open up to space and see how it changes things.
Great. Well, I want to thank you again for being our featured guest today. And I want to thank our audience for listening. This is Dr. Robert Wright of www.stressfreenow.info. Until next time, be safe and be well.